Greetings everyone, I'm Dr. Ketan Barjatia, 5th year DRNB Neurosurgery resident at Bangalore, and today I'll be discussing about antihypertensives in acute ischemic stroke. In acute ischemic stroke, hypertension is commonly seen. However, aggressive blood pressure reduction can be harmful. Elevated blood pressure helps maintain cerebral perfusion pressure, especially in the ischemic penumbra. If you lower it too quickly, it can reduce the cerebral blood flow and can lead to infarct expansion. So blood pressure should not be treated routinely in all patients. If the patient is not a candidate for thrombolysis, antihypertensive treatment is indicated only if blood pressure is greater than 220 over 120 millimeters of mercury. In such case, the goal is to reduce blood pressure by approximately 50% over the first 24 hours, avoiding rapid or excessive drops. If the patient is a candidate of thrombolysis with altiplase, blood pressure must be controlled more strictly. Before initiating thrombolysis, it should be less than 125 over 110 millimeters of mercury. After thrombolysis, blood pressure should maintain below 180 over 105 millimeters of mercury. The preferred antihypertensive agent in these settings are intravenous labetalol, which can be given as intermittent boluses, and intravenous nicardipine, which is administered as a continuous infusion. Clevidipine is another option where available due to its rapid titratability. Certain drugs should be avoided like sublingual nifedipine, and it is avoided because it can cause sudden and uncontrolled hypotension. Rapid fluctuations in blood pressure should also be avoided, and a continuous monitoring of blood pressure should be done in such patients. In patients with mild to moderate blood pressure elevation who are not receiving thrombolysis, permissive hypertension is recommended to maintain the adequate cerebral perfusion. So, the key principle in acute ischemic stroke is to preserve the perfusion to the ischemic penumbra by control and cautious blood pressure reduction rather than aggressive management. Thank you.